don't go believing anything I say. No, don't go believing me. No, don't listen to me, don't take any notice. Don't listen to anything that I say. Thank you.
Good afternoon and welcome back to Downing Street for today's coronavirus. I want to update you on the latest coronavirus data and the vaccine rollout. In the last week in the UK, we have seen 37,258 cases of coronavirus on average each day. The NHS is under intense pressure across all parts of the country, with 37,899 people in UK hospitals with COVID-19, and that includes 4,076 people on ventilators. Sadly, today 592 more deaths were reported. And we must never forget the real impact of this disease.
The fourth industrial revolution.
And I know how tough that fight is. Thankfully, there are early signs that the actions that we're taking are working.
And I don't want that comment, I should need to grow up. I'm entitled to have my opinion, you know? But if I did that, so can you not come close to me? Can you not come that close to me?
All I'm going to say...
And you haven't got a mask on, sir.
The New World Order.
Comply.
Because this vaccine brings safety to that individual, and it marks the route out for us all from this pandemic. Because octogenarians know what scientists know.
Now, unless you've been microdosing sedatives for the past 8 months, I'm sure you've realized by now that the CV-19 pandemic was manufactured.
Which is that the vaccine saves lives.
Now that evidence is not yet strong. It's a series of different bits of information that come together to support that.
Of course, the rate-limiting factor to this vaccination programme remains supply.
Their problem is they won't want to produce those vaccines unless you can show you've got a plan that if they produce them, you can use them.
As we know, supply is tight. We've had a very strong performance in this past week, and I'm confident that the NHS will be able to deliver every shot that's made available to it. This is equally true when it comes to maintaining the rules and social distancing.
Comply.
Social distancing works by denying the vaccine the social contact that it needs to spread. And I want to reiterate, social distancing works by denying the vaccine the social contact that it needs to spread.
Social distancing works by denying the vaccine the social contact that it needs to spread.
Social distancing works by denying the vaccine the social contact that it needs to spread, An important point made by the chief medical officers and the clinical advice that they've been giving.
Which is that individuals who've been infected previously and have generated antibodies appear to be equally protected against original virus and new variant.
Manufactured.
And one of the, I think, very exciting things about the science behind this is the messenger RNA vaccines in particular are incredibly fast to make in response to new mutations, so that in due course, in years to come, as we think about this, that will be something that, that I think gives an advantage to being able to get around it.
Even if you've had the jab, the rules still apply. There's two reasons for this. First, because the protection takes time. Your body's immune system is only fully trained up around 3 weeks after your jab.
And the virus probably will mutate at that point.
And even if you have the protection yourself, we still don't know whether you'll be able to pass coronavirus on to someone else.
That make us think it is likely that once you get protection initially, it lasts for a reasonable period of time, including people who've had the natural infection, where they seem to have protection for many months, certainly up to 5 months in the majority of cases.
We're monitoring that very carefully, and we'll publish information on it as soon as we have it available.
Some estimates suggest up to 1 in 10 people now have antibodies for COVID-19. If this is the case, how close are we to herd immunity?
So firstly to say, Colin, that 1 in 10 people having immunity is a far away from where we need to be. The herd immunity is a word that we use to describe the immunity that we get from vaccination. The big job here is to roll out the vaccination to those individuals, first of all to those who are at high risk of death and hospitalisation, and then to the rest of the population. Once we've done that, then we will have herd immunity.
Can you, Secretary of State, spell out how, if not when, lockdown will start to be lifted? And if you won't tell us, why not? And also to all of you perhaps, if a new variant of the disease emerges that is more resistant to the existing vaccines, what plans are there for the UK to be able to develop an updated vaccine on its own? How fast could that happen? Or would we be dependent on supply chains from other countries?
The thing is that we have to look at the facts on the ground and we have to monitor those facts. The Prime Minister has said that we will be looking at the death rate, the number of hospitalisations, whether there were new variants that significantly affect the course of the pandemic, of the vaccine rollout. And the Prime Minister set out when we will be reviewing these measures.
And a third one, which I think we perhaps haven't mentioned, if many of you look outside, I'm sure you'll see some snow out there, which is alongside all of this, our health service has to deal with the increased rate of clinical admissions due to winter and cold weather.
Dr. Hopkins.
Thank you. So from the point of view of vaccine, it's a very live issue, Laura. We are ensuring that we look at all of the new variants that are emerging globally. We're understanding which of the mutations in these variants are common and that are likely to be the ones that will come together to cause vaccine evasion. We will then use our global scientific networks to try and work with WHO and other global partners to decide what the new vaccine should look like.
Manufactured.
However, in the UK, we're already leading these discussions with our vaccine task force, and we are coming together with scientists to build what we think is the likely mutations that will cause changes in our immunity and our immune response to vaccines. And we are already looking at how fast a new vaccine could be built and rolled out. in this country.
Manufactured.
So what matters in practice right now to everybody watching is when the NHS calls, get that vaccine. But of course, we're also doing the work casting forward in case there's need for an update in the same way that the flu vaccine is updated every year.
That will cause changes in our immunity and our immune response to vaccines could be built and rolled out in this country.
On the new variants, we have identified and are putting in place what's called enhanced contact tracing, which means that for each one of those people who is identified as having a new variant vaccine, that we are worried about from abroad, there's a special focus to the contact tracing to make sure that they and their contacts self-isolate, that we check that everybody self-isolates, they get all the support possible, because it is so important that we get those new variants from abroad under control.
It's important that we realise it's quite normal for viruses to mutate, and we will have numerous mutations as we go forward. Not all of them. In fact, the vast majority of them will not be of concern. And I think the third point is it is usually when there are low rates where this becomes a really important point. So having very effective test and trace when the rates have gone right down down, and test and trace when the rates have gone right down, and test and trace when the rates have gone right down. And, you know, just to reiterate, we are not there yet. There is a lot of work to do still with everybody's help to get those rates of infection right down. But when they are down, then that's the time probably to be really harbouring in on infections.
Secretary of State. A couple of questions on variants. You've said the evidence suggests that vaccines will still be effective against the new variant identified here in the UK, but considering the increased mortality risk, is there any evidence on whether treatments such as dexamethasone are any less effective in patients with that new variant?
Thanks very much.
I'll just add on particularly on the dexamethasone. So dexamethasone and the studies that were done in the UK through the largest study in the world, Recovery, have really transformed people who are admitted to hospital and who need oxygen and improved survival. We see no signals at the moment that there's increased hospitalisation rate with the new variant. We see no signals at the moment that there's increased hospitalisation rate with the new variant. We see no signals at the moment that there's increased hospitalisation rate with the new variant. And we're not seeing a clear signal at all that has changed with dexamethasone. So we would expect dexamethasone to work perfectly, because this is about reducing your own immune response, reducing your own immune response, and calming that down so that your body can get over this virus with its own immune response, and calming that down so that your body can get over this virus with its own immune response, and calming that down so that your body can get over this virus with its own immune response. So we expect that dexamethasone will still be effective in reducing mortality with this virus, and we expect that hospitals will continue to give it, which they are doing at a very, very high level, to anyone who needs oxygen who's admitted.
So it's reassuring that our assessment is that the vaccine works against the new variant and that the treatments work against the new variant, but it passes from one person to another so much more easily that we've all got to just be extra careful to stop passing it on, because that's how we're going to get this under control. Thank you very much.
And on vaccinations, the Prime Minister has said the issue of vaccine wastage is very important, and we've been told that it's very low, but we have no information about what that means.
Well, obviously, reducing the wastage rate is incredibly important, and we exchange best practice, and part of the standard operating procedure is constantly kept under review to see how we can reduce the amount of wastage in hand. Unless there's anything either of you want to add, thanks very much indeed.